You're told you'll feel groggy when you wake up from surgery. But what they don't tell you is that the first moments of consciousness after anesthesia are a bizarre, disorienting, and sometimes terrifying experience that nobody prepares you for. And your body is going through changes you never expected. The first thing that happens to your body the moment you wake up from surgery is complete disorientation. You have no idea where you are, what happened, or how much time has passed. Your brain is emerging from a drug-induced coma, and consciousness doesn't return all at once. You might wake up multiple times without remembering it. You might ask the same questions repeatedly. Is the surgery over? Where am I? What time is it? And the nurses will answer patiently because they've heard it 10 times already from you in the last 15 minutes, but you have no memory of asking before. Here's what's happening neurologically. Anesthesia suppressed your brain's ability to form memories. As drugs wear off, memory formation returns gradually. You're experiencing consciousness without the ability to retain experiences. It's like rebooting a computer. Systems come online one at a time, and short-term memory is one of the last functions to fully restore. This is why you might not remember the first hour in recovery, even though you were technically awake and talking. The second thing that happens is intense throat pain and difficulty swallowing from intubation. If you had general anesthesia, you had a breathing tube down your throat during surgery. That tube irritated your throat, vocal cords, and possibly caused minor abrasions. When you wake up, your throat feels raw, scratchy, and swallowing is painful. Your voice might be hoarse or completely gone. Nobody warns you that this throat pain can be worse than your surgical pain initially. Here's why this happens. The endotracheal tube sits in your airway for hours. Even with careful placement, it causes trauma. Your throat was also extremely dry. You weren't swallowing or producing saliva during surgery. The combination of mechanical trauma and dryness creates significant discomfort. Some patients wake up panicking because their throat hurts so badly they think something went wrong, but it's completely normal and usually resolves in 24 to 48 hours. The third thing that happens to your body is violent shivering that you can't control, even if you don't feel cold. Post-anesthesia shivering affects up to 65% of patients. Your body temperature dropped during surgery, operating rooms are cold, and you were lying still for hours. Your body is now trying to warm itself back up through involuntary muscle contractions. You'll shake so hard, your teeth chatter, and you can't hold still. Here's what nurses know. This shivering can be more distressing than surgical pain for some patients. It's exhausting, uncomfortable, and alarming. Warm blankets help somewhat, but sometimes medications are needed to stop the shivering. The shaking also increases oxygen consumption and can stress your cardiovascular system, which is why it's monitored and treated aggressively in recovery. The fourth thing that happens is nausea and vomiting that hits without warning. Post-operative nausea and vomiting affects 30 to 50% of patients. You might feel fine one moment, then suddenly violently nauseous. Vomiting after surgery is dangerous. It can disrupt surgical sites, cause aspiration, increase pain, and raise blood pressure. Anesthesiologists give anti-nausea medications during and after surgery, but they don't always work. Here's what causes it. Anesthesia drugs, opioid pain medications, low blood pressure, pain itself, movement, and simply having had surgery all contribute. Certain people are more prone. Women, non-smokers, people with motion sickness history, and those having certain types of surgery. The nausea can last hours or days, and eating too soon makes it worse. Many patients wish they'd been warned to take nausea prevention more seriously than pain prevention. The fifth thing that happens to your body is bladder dysfunction. You either can't pee or can't stop peeing. Many surgeries require a urinary catheter. When it's removed, your bladder has forgotten how to work properly. You might not feel the urge to urinate even when your bladder is full, or you might feel desperate urgency but can't release. Nurses will push fluids and tell you to pee within a certain time frame or the catheter goes back in. Here's the reality. This is humiliating and frustrating. You're trying to pee on command while a nurse waits outside the bathroom, but your body won't cooperate. Anesthesia affects nerve signals to your bladder. Opioid pain medications make it worse. Some patients need to be recatheterized, which is uncomfortable and increases infection risk. On the flip side, some patients wake up incontinent, unable to control their bladder. which is mortifying but temporary as anesthesia wears off. The sixth thing that happens is your sense of time is completely distorted. 5 minutes feels like an hour. An hour feels like 5 minutes. You might wake up thinking the surgery just started when it's been over for 3 hours. Or you might think you've been in recovery for hours when it's been 20 minutes. Anesthesia disrupts your brain's perception of time passage. Here's what patients describe: a sensation of time skipping. You close your eyes, open them, and suddenly different nurses are there, and the clock has jumped forward. Or you feel like you've been waiting forever, but only minutes have passed. This temporal disorientation adds to the confusion and anxiety of waking up. You can't trust your sense of time, and that's deeply unsettling. The seventh thing that happens to your body the moment you wake up from surgery is emotional volatility. You might cry uncontrollably, feel overwhelming anxiety, or experience emotions that seem to come from nowhere. Some patients wake up sobbing. Others wake up terrified and panicking. Some become agitated and try to pull out IVs and get up. This isn't your personality. It's anesthesia affecting neurotransmitters that regulate mood and emotional control. Here's what recovery nurses see daily: patients who would never normally cry breaking down in tears for no clear reason. Patients who are usually calm, becoming anxious and frightened. This emotional dysregulation is a known effect of anesthesia emergence and usually passes within an hour, but it's deeply distressing when it's happening to you. You feel out of control of your own emotions, and nobody warned you this was a possibility. Beyond these 7 major things, here's what else is happening to your body that nobody mentions. Your mouth is desert dry because you haven't had fluids in hours, and anesthesia suppresses saliva production. Your eyes are crusty because they were taped shut during surgery and lubricant was used. You might have bruises on your arms from IVs. Your skin might be sticky from surgical prep solution. You're wearing a hospital gown that's exposing parts of you. There's dried blood somewhere on you. You might have a catheter still in, or compression devices squeezing your legs, or oxygen tubing in your nose. Here's what's also true. Despite all of this discomfort and strangeness, most patients are profoundly relieved. The surgery you were dreading is over. You survived. You're awake. The anticipatory anxiety that might have been building for days or weeks is gone. Even though you feel terrible, there's often a sense of, I made it through the worst part. What happens to your body the moment you wake up from surgery is a complex cascade of effects from anesthesia wearing off, surgery trauma, medications, and your body trying to reestablish normal function. You're disoriented, in pain, can't remember things, shivering uncontrollably, nauseous, can't pee properly, have no sense of time, and might be emotionally unstable. Medical staff expect all of this. It's routine to them. But for you experiencing it for the first time, it's shocking and frightening. Knowing that these 7 things are normal doesn't make them pleasant, but it means you can recognize them as expected parts of recovery rather than signs that something's gone wrong. Every bizarre sensation, every moment of confusion, every uncomfortable feeling is your body transitioning from being kept alive by machines and medications back to functioning on its own. And as uncomfortable as those first moments are, they're proof that you're on the other side of surgery and beginning the journey back to yourself.